So we're going to talk about doing pulse checks. When you're doing your vital signs, check a radial pulse, which is along the side of the thumb, and then check a carotid pulse. I generally do these, especially in an unconscious patient. You'll check both simultaneously. It's common for the peripheral pulses to be lost before the central pulses. The carotid and then the femoral arteries, those are considered your central pulses. Those are the last pulses to be lost. So to do a set of vital signs, you find the pulse, make sure you can find the pulse, have your timer with you, and then you count for a minimum of 15 seconds. And then if you do 15 seconds, you count the pulse rate for the 15 seconds and then multiply it by 4. The best way to do it is 30 seconds. You're going to get a more accurate reading. And of course, if you do it for a full minute, it's even better reading. But a minimum of 15 seconds and then multiply that number by 4. Now with pulses, specifically the radial pulse is always on the side of the thumb. So the way that I teach people to do it is you can hold their hand if you want to, like you're shaking their hand, and just roll their hand over so it exposes the wrist. Find the meaty part of the thumb and just follow it down to where it meets the wrist, and then lay your fingers across. Use 2 or 3 fingers. You don't want to use your thumb, but 2 or 3 fingers, and then squeeze down just a little bit, and then you should feel the pulse. If you're new at doing this, I always tell people that are just learning how to do vital signs, every chance you get, family, friends, anybody that'll let you do it, find a pulse. Get to the point where you can confidently go in and find a pulse. The reason I say to do that is not just the radial pulse, but also the carotid pulse. The reason I say to do that is if you ever start CPR on somebody, you want to know confidently that you don't have a pulse. And the only way to do that is to know that you can find a pulse if they have one. So the carotids, there's one on each side. I'd say check on the side that you're on, find the trachea, come about a half an inch to an inch closer to you, and then lay your fingers down, and then you should feel a pulse. If not, lift up, shift around until you find the pulse. And again, do this on everybody that you get an opportunity, especially children. Adults, different body sizes, everybody's a little different. So finding those pulses on people it's important to be able to do that. Okay, so let's talk a little bit about pulse points. We know that we've got a radial pulse, which is here, right on the radius. You've got the carotids, there's one on each side. There's also a brachial. This will come into play when we do blood pressures. The brachial's right, the way I say it is, it's just Kellyology. Break the arm where it naturally breaks. That's where your brachial is. And it's on the inside of the arm. And again, use 2 or 3 fingers, press until you can find that pulse. So you've got the brachial, the radial, the femoral. The femoral is high on the inside, just below the crease of the leg, right on the femur. So, again, that's another one that you want to, whenever you get an opportunity, somebody will let you do it, you want to try and find that pulse. If you'll uncross your legs. Then you have a popliteal, which is on the inside, right at the ankle, just towards the back. Most commonly, when we check distal pulses, we do a pedal pulse, which is the foot. Easy way to remember that is you pedal with your foot. The pedal pulse is the foot. It is right on the top of the foot, usually right in the center. And a trick to do with this is I generally carry a Sharpie with me. You can also use a regular ink pen. But once you find that pulse, take your pen, mark an X on it. From then on, you go straight to that pulse point. So those are your distal pulses. Your distal pulses are your pedal pulses, your radial pulses. You get to your central pulses, which are going to be your carotids and your femorals.